안녕하십니까. 김만기 교수의 조달 아카데미. 오늘 특별히 제가 방글라데시에 와서 방글라데시 AKS라는 진단센터를 방문하게 됐습니다. 오늘 진단센터를 방문한 가장 큰 이유는 이 진단센터에 들어가는 의료 장비를 우리 IGMP 또 우리 공공조달 과정에서 공부했던 우리 힐세리온 제품을 실질적으로 소유되어 있는 걸 한번 보여주기 위해서 이곳을 방문했습니다. 제 옆에 계신 분은 영국에 계신 우리 Dr. Niti 선생님 모시고 몇 가지 여쭤보고 말씀을 드리도록 하겠습니다. Dr. Niti, thank you for making your time available.
My pleasure.
Okay. So would you introduce your AKS Diagnostic Center to our audience in Korea?
For sure. So this is a small diagnostic center, which is like a small clinic with diagnostic facilities attached to one of our pharmacies. So that's our pharmacy next door.
Mm-hmm.
And the patients sometimes come into the pharmacy to buy medicines, and we have our pharmacists here who then give them the right advice. And sometimes they need to see a doctor, sometimes not. But if they do need to see a doctor, she'll bring the patient across and she'll bring them here to be registered with our AKS Diagnostic Center. And we have a proper record system, as you can see. And these two lovely ladies who will bring the patient in, register them, take their details, and then we pass them on to the care coordinator. Their blood pressure, their weight, we'll take the basic history, and then we'll bring them in. From there, we'll enter all that record, and then we'll take them in. If they need a diagnostic, they will bring them in to the diagnostic room. And X-ray room. As Professor Kim, you can see we have portable X-ray.
X-ray machine?
We have an X-ray machine, which is a portable X-ray machine that we are using.
Right.
As you can see, this is handheld. We have a trained technician who is actually doing the X-rays. It's being read by the software on the computer, and we can give an immediate diagnosis on if something is wrong with the patient if they come in.
여러분 여기서 이제 보시는 것처럼 이제 카이스트에서 공공조달 과정을 공부하시면서 해외에서 이런 의뢰가 많이 들어옵니다. 어떤 제품이 필요하다 그래서 사실은 몇 개 제품을 오늘 여기에 이제 우리 한국산 제품이 2개가 들어와 있는데 폴러블 저희 휴대용 엑스레이하고 휴대용 울트라사운드가 들어와 있습니다. 그래서 여기 실질적으로 이제 어떻게 쓰여지는지 사실은 얼마나 이게 효과적으로 써야 되는 이런 것들에 대해서 여러분한테 실정적으로 말씀드릴 수 있는 좋은 기회가 될 것 같습니다. So, you using this machine, how you feel? Is it functioning, everything okay?
Yes.
It's good machine to use it?
Yes, I'm good feel for using this machine.
Very good. So, we also like to see some of the ultrasound, how that works.
We have a patient in there, so as soon as the patient is done, we'll go and see the ultrasound as well.
Okay.
I'll take you in to see the doctor, Dr. Shamim. We have a patient chambers in here. Come and follow me. We have some patients in here. Patient chambers in here. We have a doctor here, Dr. Faisal.
Hello.
We have Professor Steve Field, who's helping us look at clinical quality here. He's been the regulator in the UK NHS. So we're working together to have the highest possible standards in these very small clinics, but we're creating the idea of the neighborhood clinic here with some diagnostics, some great doctors like Dr. Faisal, and looking after our patients in a more holistic fashion together. Dr. Shamim is a trained operator. Dr. Shamim, you want to tell us more about it?
여러분 이제 울트라사운드 기계가 이제 우리 힐세리온에서 만들어 제가 직접 추천해서 실정적으로 쓰여지고 있는 이 제품입니다. 그래서 사실은 제가 여러분들하고 이렇게 만나서 조달 아카데미에 관한 좋은 점은 어떻게 보면 제가 한국에서뿐만 아니라 이렇게 해외에 이렇게 나오는 기회가 있을 때 제가 추천했던 제품들이 현장에 어떻게 쓰여지는지 또 어떻게 이제 조달 과정을 통해서 공급을 하고 또 실정적으로 어떻게 사용되고 이런 것들에 대해서 찾아보기 위해서 한번 찾아왔습니다. 그래서 한번 우리 선생님께서 이 기계가 어떻게 쓰여지는지 한번 보여주시면 좋을 것 같습니다.
Sonon ultrasound, Sonon wireless portable machine, ultrasound machine, and this is the 300L 300C ultrasound machine. We can use this convex ultrasound machine for the whole abdomen. We're scanning the pregnancy profile, lower abdomen, as well the KUB system and the hepatobiliary system as well.
Excellent.
Very good. So almost the whole body we are using this for.
Yes,
yeah?
ma'am.
Yep.
And another is this one the linear probe. We can use it for the breast and thyroid,
I see.
for the superficial
I see.
organs. An app here, and we can use the app with the connecting with the device. After that, we just connect here. These are the
look at the Hilsarion.
yes, Hilsarion, work list, patient list, and start scan. So first we connect with the device with the internet, and this is the two Sonon 300. We connect with this 200. Then patient list.
Oh,
So I can add the patient details here. First
Very
name, ID, and also the sir.
So it goes
Here the
straight.
sex, date of birth, and LMP. So I can save here. Okay.
I see.
Patient
all of
ID is
the
mandatory.
package
Yes, sir.
inside the software provided by the Hilsarion.
Yes.
우리 대표님도 그렇고 여러분들이 사실 우리 과정을 거치면서 해외 진출하는 그 기본적인 그런 방법을 또 배우시고
Yes, sir.
실질적으로 사업 개발을 하면서 이제 이렇게 연결됐을 때
Right, sir.
현장에서 이렇게 이제 쓰여지고 또 힐스케어에서 만든 이런 소프트웨어까지 기능적으로 하는 거 보면 정말 너무 감사하고 좋은 기회가 됐던 것 같습니다. Thank you, doctor. Thank
So
you
this
very
is
much.
here after the scanning, we save the image here. Every image is here, and after that we just send it to by email in my laptop. After we print the image from
Very
there.
good. I have
And
one question.
Yes, sir.
So compared to many other ultrasound, when you go to a big hospital, you have
Yes, sir.
ultrasound machine,
Yes.
very big one. So compared to any other machine, very open, honest opinion, yeah? Because
Yes,
this
sir.
is shared with one of my student company,
Right,
yeah? So compared to any other machine you've been using before, compared to Hilsarion, so what would you say Hilsarion technology
Sir,
and then
yes, technology is very updated, sir. Very updated, and actually this machine is for our emergency purpose. We can serve it emergency purpose. We can, because it is the wireless, sir, first of all, and we can carry it to in home for any kind of emergency patient. So
Very
this
good.
is the advantage, main advantage.
And
for
the images
this
are pretty
machine.
good, right?
Yes, ma'am.
Images very
Very good. Yeah.
I'm setting here first everything precise settings is here, then every image is fine.
So when you expand the operation, you
Yes.
have another 38
Yeah.
clinic. So I will be the first to recommend Hilsarion again. We have ultrasound product. I'd like to see all of your clinic will have our Korean-made product.
Right. sir.
Absolutely, and we love these Korean-made products because they are so adaptable and they have the technology as well adapted to read
Right.
the software to read some of this to help our doctors as well. So we really like it. And then for our next round of expansion,
Yeah.
we look forward to more of these kind of devices
Yeah.
from you, Professor Kim.
Thank you very much,
Thank
Doctor.
you, sir.
And then,
Thank you
Dr.
very
Niti,
much.
would you mind to go through the pharmacy again
Yeah,
inside?
sure.
Okay,
Sure.
Let's go follow her.
Yeah, sure. We are now entering our pharmacy, which is attached to our diagnostic center. It's one of our, it's a decent sized pharmacy, and we stock a lot of the medication here. As you can see, this is a model pharmacy. It's temperature controlled. It's fully regulated in compliance with all Bangladeshi standards. We have our pharmacist here who is going to just take us through, and this is one of our trained pharmacists, and she works a lot in actually setting out the care pathways, the right kind of treatments we give to our patients that walk in through our doors. So this is these are our sales folks in our pharmacy. As you can see, the shelves are well stocked, very well temperature controlled. We have a counseling area in which the pharmacist can take the patient, the customer aside and have a quiet chat with the patient. In case they need any point of care testing diagnostics done, they can be referred to the clinic next door, and our software systems communicate with each other. We have a lot of non-pharma stuff, as you can see, but people come in for a lot of other things as well. They'll come in for their babies' milk, the diapers, and all the other things. But our main work is around stocking good quality medication, a good range of medication that doctors are prescribing, and to become the pharmacy of the neighborhood.
So, 여러분들 보셨던 것처럼 좀 이게 사실은 이제 방글라데시의 그 다카의 그 뒤쪽에 보시면 그냥 어떻게 보면 그 평범한 동네 가운데 있는 병원이 없는 지역에 우리 공중 보건소 같은 그런 역할인데, 이 회사가 사실은 이제 커뮤니티 센터 그런 형식으로 약국과 보건소의 역할을 같이 묶어서 아까 보셨던 그런 이제 울트라사운드나 폴로 엑스레이 기능도 있으면서 이 약국을 차렸는데, 보시는 것처럼 사실은 한국 약국과 크게 다른 게 없을 정도로 기능과 여러 가지 그런 그 시설이 너무 잘 돼 있어서 저도 사실 상당히 놀랐습니다. I was very surprised quality of actually system you have it here, and also the facility actually, and not much different to that of Korea where we have it.
That's
I'm
nice to
very,
hear.
very surprised, and congratulations for your vision to make a lot more program for, I guess, at the end of the day, universal healthcare. For the
Correct,
Bangladesh
correct.
people.
And we will have, currently we have 35 pharmacies, but we'll be in the next year and a half, about 100 across Bangladesh. And we will do it. So, and to many of these pharmacies, we will have attached diagnostic centers so that the patient journey is fully complete. They see the pharmacist, they need a doctor, they've got a doctor there, you need an ultrasound, you need a diagnostic, it's here, so that the patient doesn't have to go to many places, and it's all affordable. It's
Okay.
within a small ticket size.
For last comment, I'd like to ask your opinion. Now we are going to work more closely. I'll be recommending a lot more innovative Korean medical devices,
Yes.
ultrasound, and many other. I have more than 200 different items. So what would your recommendation, or what's your strategy to expand the operation in here and elsewhere?
So,
With the Korean
yes.
innovative medical devices and equipment.
So we work very well with you, Professor Kim. And I think really understanding what you have is the next step. And we've started to explore that. We're also starting to understand what our doctors and nurses want to have here for diagnostics. And particularly when we set out, the 12 care pathways I spoke to you about, making sure that we have the diagnostics from the Korean Innovation Lab to match some of the care pathways so we can complete the patient journey. So we're looking forward to working with you more.
Thank you. 여러분, 오늘은 특별히 방글라데시에서 우리 조달 아카데미 특집본으로 보내드렸습니다. 또 이렇게 기회가 있을 때마다 해외에서 또 제가 ADB나 다른 그런 국제기구를 방문할 때도 같은 형식으로 현장의 정보를 보내드리도록 하겠습니다. 방글라데시에서 김만기 교수의 조달 아카데미 전해드렸습니다. 여러분, 감사합니다. Thank you, everybody.
Thank you.